Hello, it's 7:30, so we'll get going. There's a lot of people signed up for this masterclass tonight. So it'd be great to have a lot of people joining. So the topic is obviously everybody's favorite, threadworms. What else would you want to be talking about 3 weeks before Christmas? But I think the level of interest that there has been in this masterclass is really reflective of, the issue that this is for people with children. So we're going to be talking about threadworms, how to get rid of them and how to stay rid of them. And that's a lovely little example of what threadworms look like in the jar. So I'll go through the information that I have, first of all. For those who are very interested in, the scientific basis for what I'm saying, there is a few pages of references at the end. And if you want any of those references emailed to you at a later date, please let me know. And I would say let's do questions at the end. So if you have a question as you're going along, write it down or pop it into the chat box and I'll answer them at the end. Just because there's so many people potentially joining, it could be a bit chaotic if we're stopping and starting to answer questions. So just make sure I'm recording. Yes, I am. Okay, so how to get rid of threadworms. So just to introduce who we are at the Pediatric Naturopath. So we're a team of 4 practitioners. And so there's Summer, Kelly, Amy, and myself. And we just do kids' health. Like, unless it's a very unusual circumstance, we just do kids' health. So we're deep into all the things that are to do with children's health. So eczema, allergies, immunity, constipation, and then with bigger kids, teenagers, you've got period issues, you've got acne, you've got mood swings. That's what we do. That's our gig. So if you ever need individualized help for your child, definitely give us a shout. So here we are. I'm a naturopath. I'm Lisa. I'm a naturopath and a nutritionist and a feeding therapist. Summer is a nutritionist and a feeding therapist. Kelly is a nutritionist and a naturopath, and Amy is a nutritionist and a naturopath. So tonight we are going to be talking about what threadworms are, where you catch them, symptoms, both the symptoms that are kind of well acknowledged, as well as some weird and wonderful symptoms. We're going to talk about testing for threadworms. We're going to talk about blood tests, and we're going to talk about actually treating the worms. So as I said, everything that I talk about is evidence-based, and I do have references to share at the end if you're that way inclined. It's very practical. I've thrown in some quick wins, so things that you can do immediately that are going to help. And then at the end, we'll do the Q&A. So what are threadworms? So you can see this is a little ruler which shows the size. One's the male, one's the female, one is slightly bigger than the other. So the technical name is Enterobius vermicularis, and it's a type of helminth. I should just say, I assume that everybody can hear me, or somebody would have put it into the chat box by now, and they haven't. So I'll just assume that you can hear me. So worms are transmitted through ingestion, so eating of the eggs, which might be found in food, water, dust, or anything really. And at nighttime, the female worm will come out to the perianal area and lay her eggs. But the problem is that some of these little worms, when they come out, will get a bit lost and they'll find their way into other orifices in that region, especially the female genitourinary tract, and giving lots and lots of symptoms. So the eggs, I should have said, if you're easily grossed out, it's probably not the right masterclass for you. You might want to go and get a cup of tea instead. But what happens, the eggs get stuck to the person's anus with a type of glue, and that glue is very, very itchy. So worms are clever little critters. they want to perpetuate the life cycle. So they make this glue itchy, which means that your child at nighttime, what do? They scratch their bottom and then suck their thumb. So not only is the glue sticky, but also the wiggling, the migratory movements of the worms whilst they're doing this also causes an itch. So the child scratches the bottom. When they scratch, they actually break up the nail and they release lots and lots of, or they break up the worm, they release lots of eggs all over the place. And then they stick their hand in their mouth and eat the eggs. So as you can see, lovely little lifestyle. Itch the bum, eat the eggs, larvae hatch in your intestine, and on it goes. So how do you catch them? That was the life cycle, but how do you actually catch them? So these are common places where you can catch them. And I'd say the most common on all of these is daycare, because in daycare, got lots of little kids scratching their bum, sticking their fingers in their mouths, very close contact. Everybody's going to the toilet together. You know, hygiene's possibly not the best. I mean, all the kids are trooped into the bathroom to wash their hands, but how well are they actually washing their hands? It's a hotbed for worms. Public transport, the public toilet, sorry, first of all. Another thing, like the worms, or the eggs rather, can live for about 2 weeks out in the open. So if some eggs come off a person onto a public toilet, they're there for the next person to catch. Same with public transport. If someone has eggs under their nails and, you know, they've got their hands on their seat, the hands in the bar, and then you come along and you touch the same thing, you can catch them. And food handlers. If food handlers are not washing their hands really well after they go to the toilet, same thing. So people often, you know, feel guilty and disturbed when their child gets worms. But as you can see, it's so easy. And when I looked into the statistics of, you know, how many little kids have worms at any one time, like the statistics were all over the place, but about 20% is a good gauge. So in a daycare with 60 kids, 12 of them probably have worms. So these are the risk factors. So not washing your hands before eating is the number one, because of that life cycle where, you know, you've got the eggs and then they have to go into your tummy and round and round and round. You can break that life cycle by washing your hands really well. So not washing your hands, major risk factor. Chewing toys and pencils, also, because remember, the eggs can be anywhere. They can live on anything. So then if a child's like sharing toys, sharing pencils with their buddies at preschool and then chewing them, another big risk factor. Now, low secretory IgA. I know there's a lot of practitioners signed up to watch this tonight, so practitioners will understand what this means, but it's basically when the immune system of your gut is not as robust as it should be, you are more likely to catch worms. So when we do stool testing, this is one of the things that we look at. And, you know, if you've got low secretory IgA, you're a lot more likely to catch gastro bugs and just pick up everything that's going around, like worms being one of those things which is going around. And just being a kid, being a child under 10, for many reasons. One of them, because they don't wash their hands, they do put their finger on their bum and they're in close contact with people. So just all of those reasons make it more likely in children under 10. So the quick tip, something you can do immediately, get your kids to wash their hands with soap and water before eating. And critically, hand sanitizer doesn't kill worms. So if you're one of these people who during COVID has thought, oh, hand sanitizer is handy because instead my child has to climb up, they might burn themselves on the tap, they spill the soap, blah, 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 blah. We'll just give them hand sanitizer. Stop. Throw out the hand sanitizer because it causes so many problems. And research shows that, you know, daycares that use hand sanitizer have more outbreaks of norovirus, a really bad gastrobug, than daycares that don't. So if you're letting your child just use hand sanitizer before meals, you are going to be perpetuating that life cycle of the worm. and keep their fingernails short so that there's not room for the eggs to take up residence. Like, I've got 3 kids, and we obviously often have other kids around for dinner or food or whatever, and I always get my kids to wash their hands before dinner, just because they're grubs, like all kids, they're grubs. And I'm amazed at how many kids, when I say, right, dinner time, go wash your hands, how many kids look at me like, oh, what's this? Like, that they don't do it at home. So it's free. Start it today. It's also very relaxing. If your child is a fussy eater, washing your hands can be a very relaxing thing to do to get them into the zone. So these are the symptoms of threadworms, and these are the ones that you probably maybe know already. So anus puritis, which just means they get an itchy bum. But only 50% of people will get an itchy bum. So if you think, my child's never had an itchy bum, therefore they've never had worms, you're probably wrong, because in half the people, they won't have that symptom. Bedwetting. So, you know, some children wet the bed just routinely until they're about 7. That's not really what we're talking about. We're talking about more the kids who are dry at night, and then all of a sudden they're wetting the bed. Poor sleep quality, so tossing and turning. Incontinence during the day as well as at nighttime. Again, if they were previously okay and all of a sudden they're wetting themselves at school. Poor concentration at school, because they've had a crap night's sleep, they've been tossing and turning all night, and now guess what? They've got inattention. Restlessness, lack of appetite. So people will often say to me, you know, my child eats like a horse, they might have worms. I would say it's actually usually the opposite. It's when a child is off their food that it's more likely to be worms. Being irritable, again, due to having something scratching at your bottom, plus not having a good night's sleep. Weight loss, vomiting, abdominal pain, and diarrhea. So these might not be as common as some of the other ones, but they're definitely potentials. So can your child have threadworms and you not know? Absolutely. Yes, they can. So these are some other symptoms. So vulvovaginitis, appendicitis. So I have had clients whose kids have had their appendix out, and when the appendix has been sent off for a biopsy afterwards, it has been full to the brim with worms. Teeth grinding. I've had kids come to see me with chronic teeth grinding, like they're damaging their teeth, they've got headaches, they've got it all going on. Give them some anti-parasitic treatment and they stop grinding their teeth. Eye issues. So, you know, you've got eggs under your nails, you itch your eye, all of a sudden you've got eggs in your eye. Fallopian tube invasion, so they've actually migrated all the way up into the fallopian tubes. Vaginal bleeding. I mean, if your child has vaginal bleeding before they start their period, you know, you need to get it investigated, but it could be worms. Bladder issues, so irritable bladder and urinary tract infections. So not only do the worms migrate, but they carry bacteria with them. So they're living in your anus, which is full of things like E. coli bacteria. Then they carry that into your urinary tract and cause urinary tract infections. This is a good one, pityriasis alba, which is a funny little skin rash that you can get. Psychiatric disorders such as depression, anxiety, and sleep disorders. So if your child has any of these issues and you go for a sleep study, they say, yeah, they're not sleeping very well. And that's kind of the result of the sleep study, which is not really that helpful, but maybe it's worms and death. So I did come across one paper, and it was an adult, I think somewhere in the Middle East, who actually died from a threadworm infestation that he did not know that he had. So how do you know? If you can't rely on them having an itchy bum, which you can't, the next thing you need to do is the sticky tape test. So when your child wakes up, You need to be there when they wake up to make sure that they don't get up and get out of bed. Get some sticky tape, just normal sticky tape, and stick a little bit over your child's anus and push. The eggs will stick to the tape. Now, the eggs are very, very, very small, but if you hold the tape up to the light, you should be able to see them. And I mean, this is the gold standard test. You would think there would be something better at this stage, but there's not. I went through all the literature looking at this, and this is the test that they use when they do studies. So you hold it up. I mean, in a study, they use a microscope, but we don't have microscopes generally. So you hold it up to the light and you repeat that for 3 to 6 days, and that's 95% successful in determining if your child has worms or not. So what about blood tests? So no, you cannot test on blood tests for worms, but there are clues. So there's a type of white blood cell called an eosinophil, and that can be high on a blood test if your child has a parasite. Doesn't say if it's threadworms, could be something else, also could be a food allergy. So it's by no means definitive, but if you see high eosinophils, you think, why is that? Low protein and low ferritin, because the parasites are munching through the ferritin. So they're clues, they're not definitive. Stool tests, they're unreliable. They do not accurately test for worms. And so I just saw a chat question pop up, which actually is about this topic, so I'll answer that. So GI map does actually have a bit in it, a section in it, to test for threadworms. And I have had clients who have had threadworms in the poo sample and they have sent it off and it has come back as not detected. So some stool tests do check for threadworms, but it's unreliable. And in the hundreds that I've done, never, ever have I had one come back positive for threadworm. So just ignore it. But those stool tests will show these two things. So Dientamoeba fragilis, which is a type of parasite, and Citrobacter. And when someone comes to me with chronic worms, these two things will invariably pop up. And then I go, maybe there's worms. So we've got Vermox, we've got Combantrin, the over-the-counter medication. So why not just use that? And yes, if your child just gets worms once, that's fine. Just go to the shop, buy the chocolate squares, that's fine. Follow the instructions and repeat at the stated time period. Some of the medications will say 1 dose once, and that's not true. That's not how it works. You need to redose in 2 weeks. And it just makes me think, why are they saying that? Is it to make people think it's going to be a really cheap course of treatment, or is it to increase resistance and make you have to come back in 6 weeks to buy more? I don't know. But you need to repeat it in 6 weeks, in 2 weeks, sorry. But a lot of people I see have been, they could take out shares in Combantrin because they've used it that much and their child still has worms. So then you can't keep like doing the same thing over and over again and getting the same result. Resistance is increasing to these medications. And it's like antibiotic resistance. If we keep just using the over-the-counter medication over and over and over again when it's not even working anyway, at the end of the day, we won't have that as an option. You can actually cause liver injury for some people who have something called Gilbert syndrome, which is not rare. I have it, my entire family has it. Some other practitioners on the team have it. So it's very common, and a lot of people wouldn't even know that they have it because it's not really that important, but it makes you more susceptible to liver injury from this. You can't use it in kids under 2. Which begs the question, well, what do you do for kids under 2? And the solution is you manually remove the worms and the eggs from your child's bum. So, and you have to do that every 3 hours because it takes, whenever the eggs come out, it takes 4 to 7 hours for them to hatch or something. But if you clean their bum really well every 3 hours and pull out the ones that you see and remove them, then theoretically you'll break that cycle. And if your child has epilepsy or they're on seizure medication, you need to speak to your pharmacist, because sometimes this medication will not be suitable. I'm not an expert in that, just speak to your pharmacist. So this is the Vermox Combantrin, it's called mebendazole, and you repeat after 14 and 28 days, not just one dose. You can get some symptoms like nausea, vomiting, diarrhea, flatulence, cramps, but most people don't. And it won't help the extra intestinal symptoms or infestation. So if your child has worms in their eyeball or worms in their vagina or worms in their urinary tract, this medication doesn't work, because it's working on your gastrointestinal tract. You eat it, it comes out, it works in your gut. But if the infestation is elsewhere, it's not going to help. You need to think a little bit more strategically. There are other medications that do work more systemically, but they're not readily available to most people. And if you watch this presentation tonight and you think, well, I just want to stick with the Vermox or the Combantrin because that's what I know, then you may have to treat every 2 weeks for 16 weeks. And whatever you do, don't worm once a term. You should never give your child medication that they don't need, but also that is contributing to resistance. And then when you need it, it won't work. So this is the parasite that I often see come up on a stool test, Diantomoeba fragilis. So it's transported by the eggs, so by the worm eggs. And so these two organisms go hand in hand. And if you work on the overall ecosystem of the gut, which we'll talk about a bit later on, and you improve the immune system of the gut, so you improve the secretory IgA, you'll ultimately bring both of those organisms down to a manageable level. Herbs that kill threadworms will also kill Diantomoeba fragilis. And the only time I will ever treat Diantomoeba fragilis is if the child has persistent and chronic threadworms. Because it's not, this parasite is not necessarily bad. They've done big studies with hundreds of kids. Half the kids have Diantomoeba fragilis, half the kids don't. And the ones without it have just as many gut symptoms as the one who do. So I would never look at a stool test, see Diantomoeba fragilis and think, oh, we must kill this parasite. No, but if it's buddying up with the worms and causing that chronic worm infestation, then yes, I would. I've got trouble with going backwards and forwards. The other bacteria that I see is Citrobacter. And I scoured the research and there's no correlation in the research, but I see it all the time when I test kids with chronic threadworms, and this bacteria pops up. And then I use things like licorice, so not like licorice all sorts, but the herb licorice and slippery elm, as well as prebiotics and probiotics to reduce the Citrobacter and therefore reduce the worms. But ultimately what you need to do is improve the terrain of the gut, the ecosystem. So killing doesn't really get you where you need to go. So it all comes down to diet. So eating a whole foods diet based mainly on plants is the way to go. And I'm not advocating a vegetarian or a vegan diet at all, but your diet should be mainly plants with animal products as well, like in my opinion, meat, eggs, all of those sorts of things. And to improve the diversity of your gut bacteria, you need to eat a diverse range of plants. So you could eat a whole food diet, but you're just eating brown rice and broccoli every day. That's not going to be very effective. You need to be aiming for 40 different plant foods every week. So black rice, brown rice, red rice, broccoli, kale, cabbage, like nuts, seeds, all the different plant foods. Try and get 40. 40 is a stretch, but it can be done. Even for kids, it definitely can be done. Minimizing sugar and processed foods. So when you eat something very processed, there is none of that food left in your gut for your bacteria to eat. So by existing on processed food, you're starving your good gut bacteria. Prebiotics. So prebiotics are the food that feeds the bacteria, and probiotics is the actual bacteria. Really, really good to improve your gut. Don't just kill. And if your child has chronic threadworms, we really do recommend that you do a stool test. And yes, they are expensive, but so is treating a family of 5 with Combantrin every 2 weeks for 16 weeks. And that's still just kill. It's not going to improve the overall health of your child. So we want to do more of this. So, get your kids out gardening, get them dirty in the soil, lots of fruits and vegetables, oily fish, fermented foods, do all these sorts of things. And then, less time in front of screens, less lollies, less processed meats, less soft drinks. That's ultimately what you need to do. But there are some foods that will specifically help to remove worms. And they are papaya seeds, garlic, carrots, and pumpkin seeds. So this is a study that was done with papaya seeds. And I tried this myself. I didn't have worms at the time, but I scooped out the seeds of a papaya. I had to wash them to get the fruit off it. So it was only the seeds. And then I dried them out in the oven for an hour and a half. And then we ate them. They were okay. They weren't amazing, but they were okay. You could definitely do it with a child if you needed to. So they did a study with papaya seeds or mixed with honey or just honey. And it was the clearance of the worms was between 70 and 100% with the papaya seeds and 0 to 15% with the honey. So absolutely, papaya seeds do work. And I think it was, they took it for 5 days, maybe. I can never read under pressure, but it wasn't very long and it worked really, really well. Easy, cheap. This one's also cheap, but definitely not so easy. So it's the effect of a garlic suppository. Yes, a garlic suppository on the treatment of worms. And so the percentage of cured people during 3 days was 75%. And after 7 days, everybody had got rid of their worms using this particular treatment. So they literally cut a garlic clove in half and stuck it up their bottoms. So I'll let you decide if that's appropriate for you and your family, and this is the research study if you want to read about it. So garlic is a potent food to get rid of parasites. You can definitely eat it. And if you eat it, you want to eat it raw. So hummus, make hummus, throw truckloads of raw garlic into it and feed that to your child, or pesto. Or if you're doing a stir fry, throw the garlic in just before you serve it so it doesn't get cooked through. All that raw garlic will work in your gut, in your digestive tract. It won't work if the parasites are somewhere else. But yeah, this was a fun study to come across. So something else that you can do is using a barrier cream on your child at night. So it's effective for a number of reasons. So it'll stop your child itching. So if you can break that life cycle by stopping the scratching with the finger, then you stop it being ingested and you break the life cycle. It also will stop the eggs sticking to the bottom. And you can even add some essential oils to the barrier cream to help kill the eggs and remove them from the equation. So that's something that you can do. You can also, anything that's going to stop the bum to mouth action. So gloves, wearing a baby grow instead of separate pajamas and bottoms, so there's no access to their bum. All of those things are going to be helpful. But I like the barrier cream because it also stops the itching. And as herbalists, as naturopaths, we can add something like chickweed into the cream to stop the itch. And then we can add essential oils in to kill the egg. So we can make a really bespoke cream for you based on what your concerns are. So from a hygiene point of view, this is what you need to be aiming for. So washing your hands after the toilet and before eating. Stopping nail biting by keeping your nails really, really short and really, really clean. Changing your undies every day and washing at 40 degrees to kill them. So whilst hand sanitizer does nothing to kill the eggs or the worms, heat does. So that's a really good tool to have. Don't share towels. You want to change your sheets as much as possible. It's such a pain in the neck, but whenever you change sheets, you want to wrap them up and roll them into a ball. You don't like pull the sheets off the bed and walk through the house like because you're just spreading the eggs everywhere. They land in the dust. Your child puts the dust in their mouth. You're back to square one. So you want to like fold up the sheets very carefully and put them in the wash, and then you'll vacuum the room and stuff as well. And wash their bottom every morning, or really as much as possible, and put stuff on it that's going to stop it itching, and treat the whole family. You can't treat the whole family if you're pregnant or whatever, or if the kid's under 2, you can't treat those. Then you have to do the manual removal. I also love flower remedies for everything, but including this. So in the bush range, there's something called green essence and bottle brush, which are really good for removing the worms. And then in the back range, there's something called chicory. So the great thing about flower remedies is that they have no taste. They're extremely cheap, and you just pop it in your child's water bottle. And the same with homeopathy. Very cheap, doesn't taste of anything, and you just put it in your child's water. And I have used homeopathy in particular with kids, and the results have been outrageous. So there was one client, and it was a little boy, and he had worms multiple times in the past, and he would get a sore tummy at bedtime. That would be his only symptom. No itchy bum, nothing else, just at bedtime he'll get sore tummy. And so the parents had a look. When he said he had sore tummy, parents had a look, and it was like Medusa's head, the number of worms wiggling at his bum. So obviously she gave him Vermox. And the next night, same thing, sore tummy, Medusa's head. And so then they had an appointment with me after this had gone on for a while, and I gave them a homeopathic remedy. And the next day, when the child did a poo, there were, no joking, 100 dead worms in that poo. So the Vermox hadn't worked. And then, there was a significant time period before they started the homeopathy, and then that worked. So be open-minded about what you're going to use. And I'm not a homeopath, but there are some combination homeopathy products. Unfortunately, one has just been deleted and you can't get any more, but there are other ones that have a few. It's not classical homeopathy, it's very much layman's homeopathy. They've just got a few different combinations of remedies in there that might help with worms, but they absolutely work. So I skipped past herbs just because I wanted to talk about homeopathy and flower in the same sentence, but there are also herbs that you can use. So wormwood, this is a picture of it. It is so bitter. The chances of you getting most children to take that are fairly low. And all the clove and the thyme taste marginally better. And they're good, they work, but they don't improve the terrain. So, you can certainly use these instead of Vermox or Combantrin if you can get your child to take them, but you still need to work on the terrain of the gut. You can't just do this. So this is when I said, who has questions? On Instagram, this is literally the questions that I got. Although an amazing amount of people can't spell vagina. Everybody wrote Virginia. So if your daughter specifically, has worms in her vagina, she might have really itchy, she might have urinary tract issues, you might think that she's got thrush or something going on, and it could be worms. And taking Vermox won't get rid of them because they're not in your gastrointestinal tract, they're elsewhere. But these are some things that you can do. So a sitz bath just means a really, really shallow bath. You can even just use a bucket or like a tub or just kitchen sink, even depending on the size of your child. And you add some worming herbs like the wormwood to that and just put your child sitting on them. And you probably want to do that every night for 5 nights. You can put on the ointment, so the barrier cream, which will stop the irritated tissue from itching. So we'll stop that, bottom to mouth action because it's not itchy and scratchy. And it will also interrupt the worms on their nightly escapade into the vagina. Garlic, so you could add some of that into the sitz bath or into a barrier cream, and showering every morning. So, a bit like sort of manually removing them. If you shower every morning or even 2 or 3 times a day, that will help to remove them. And if you constantly remove worms, after about 2 weeks, they die out because you're not reinfesting yourself. So you want to do all these things for about 2 weeks. So that's the end of my presentation, but you can now ask questions. So I'll just start with the questions that have already been asked. So there's one about GI map. Yep, I've answered that. What products would you recommend for practitioners to prescribe to young children with worms? So it really, I love it if you can just do a stool test and look at, is the secretory IgA really low? Is there, the Citrobacter and the D. fragilis? Is there just an overall lack of diversity in the gut? It's really good if you can look at that entire picture. I would say what I don't use is chondroitin sulfate because I know that's quite often recommended for practitioners to use, and I've tried it and I didn't find it to be useful. So lots of prebiotics, lots of probiotics mainly, and then things like licorice and slippery elm if there is the Citrobacter. Is there a connection between high strep in the gut and the worms? I haven't seen that, but certainly anything that's, if your gut is out of balance through having high strep, that's going to make it susceptible to taking on worms, so potentially. So can you explain how to remove the worms manually? It's horrific. And this is more for young children, but so say in a 1-year-old where they picked up worms from their lovely big brother, but you can't use Vermox. Whenever you're doing a nappy change, you want to get like a wet wipe, like something disposable, and literally as you see the worms coming out of their anus or eggs, you pull them out and throw them away. So logic would say if you can do that during the night, that's going to be the best thing to do. So if you can actually set your alarm every 3 hours, so 3 hours is the magic number because it takes 4 hours for the eggs to hatch or whatever. So if you can set your alarm every 3 hours and remove the worms and dispose of them, that's what I mean manually. For how long? 2 weeks. You need to do that for 2 weeks. When you say to shower the girl each morning, how do you suggest to clean her vagina? Yeah, so you obviously don't do like a douche and like spray up into her vagina. It's more about cleaning the perianal, like the outer area, to get rid of any eggs or any worms that are still out onto her and just remove them like that. You don't do any internal washing. And no products. You can do a sitz bath with the herbs. And I guess you could also get like a spray bottle with some of the wormwood in water and get her or you to wash the area with that in the morning if she's not too sensitive. But yeah, it's a sensitive area, so you might have to do more of a barrier cream. Okay, you mentioned weight loss. For worms, they can lose weight over the time of having the worms, or worms can stop the gain of weight. Well, both. So the worms could actually cause you to lose weight. If you had a chronic infestation of worms, and you don't know about it because you don't have the itchy bum, then yeah, you can definitely lose weight. But if a child is losing weight, you need to get everything worked up. Children will often slow their weight gain or stop their weight gain, but when they lose weight, you need to get everything checked by your GP, but sometimes that doesn't lead anywhere. Then you could make an appointment with one of us to kind of evaluate why. But yeah, so it can either, having worms could make you lose weight if you have a chronic infestation. Do I find that nighttime chronic teeth grinding is often worms? Yes, absolutely. I know that it's related to other things, especially anxiety. But in my experience, and maybe it's just the population of people who are seeing me, but in my experience, it's pretty much always worms. It's such a simple fix as well. So that was all the, do antibiotics kill them? No. Doctors, whenever doctors do stool tests and they see something like blastocystis or Amoeba fragilis, they will often put the child on antibiotics, and the success rate is horrendous. They don't work for those, and no, they don't work for worms at all. Vermox theoretically does, Convantrin theoretically does, and ivermectin will, but you can't really get your hands on that. And ivermectin is the one that's more if it's a systemic infection, not just in the gut. Does anybody else have any questions? You can also unmute yourself if you're game, if you want to ask me a question out loud. I'll just, whilst I'm waiting, see if anybody else ask a question. These are our details if you do want to get in touch. So that's my phone number. You can make an appointment online, www.thepediatricnaturopath.com.au. And if you go to the book now button, you can book with any of us. And on social media, so I'm mainly active on Instagram, and that's just the Pediatric Naturopath. I'm going the wrong way again. And as I say, these are the references. So if you have some fascination with reading where all this comes from, you're more than welcome to contact me, and I'll send you those. A few more questions. Are worms carried by foods, e.g. raw, wild caught fish? No. So threadworms, so the specific worms that we're talking about, the only host for these are humans. So you can't catch them from your dog, your cat, fish. If the host is humans, yes, they live in dust and stuff, but you're not going to catch it from another animal, which is really good. There's different parasites, different worms that you can catch from different things, but not what I'm talking about. Mrs. Beginning. No, I will. I've hopefully recorded this, and it will be uploaded in the next few days. And I will, everybody who signed up for the webinar will get this emailed to them in the next few days. So yes, sorry, I should have said at the start, threadworms and pinworms are both the same thing. Roundworms, whipworms, something different, but threadworms is kind of the Australian word. Pinworms is more what they say in America. And then the Latin word is the Enterobius vermicularis. So question, in a stool test with high Amoeba fragilis, would you be suspecting worms? I would still do the sticky tape test, because that will tell you whether you need to treat the fragilis or not. Yeah, do the sticky tape test. So much fun. So many fun things that we get to do as parents. Would anybody else like to ask me anything, or are you all sufficiently traumatized after that? Yeah, the things we do. Cool. All right, well, I'll stop recording there.